Hello, how's everybody doing today? So, this is going to be my first YouTube live video. I attempted to do one a little bit ago. So, if you saw that, I kind of messed up and have people, have people in the house with me and things like that. Um, so, anyway, little update on COVID-19. This should be my last video on the COVID-19 pandemic. Because I feel like there are millions of videos out there now. It's all we hear about. It's in the news, it's on the radio, it's everywhere. Everywhere you turn, billboards, I mean, everything. And rightfully so. I mean, it's a pandemic, but I'm like, what can I say that hasn't already been said or isn't already being said? So, with that said, I'll just do a quick little update. Because there's so much information. The CDC and the World Health Organization, they're putting out reviews all the time, or new news all the time, I should say, on COVID. And essentially, we need to turn to them and listen to what they say in this time of a pandemic, because they are the experts and they know the best treatments, the best things to do to prevent it, and we have to listen to their guidelines. In my first video on COVID, I told everybody not to panic. And people ask me, they say, do you still feel that way? Are you still not panicking? And I say, no, I'm not, because the reason I'm not is because, for one, panicking isn't going to solve the issue. And what I mean by panicking is, being terrified to do anything, right? Letting it control our lives to the point where, we're having anxiety, where we're living in fear and things like that. So I just tell people, don't panic. Just listen to what the CDC and the World Health Organization, what they recommend, right? Check in with the updates from the president and from the the head of the CDC when he's on TV. But I don't personally sit and just watch the news all day long. I know family members who do, watch the news all day long. And it's nothing but panic, because they're going to tell you about every single person, it seems like, who passes away from COVID-19. And it's depressing. I mean, it is. It's very depressing to just continuously hear that all day long, every day. Or every time I turn on TV, that's what I hear, which isn't often. I'm usually trying to study or just steer clear of that. So I'm not having anxiety or being anxious about it. But again, do not panic. And last time I checked, I think the mortality rate is still roughly the same. I could be wrong. The data is always changing, but I want to say it's between 2 to 3% still. So most people survive that get it, but that number has increased the amount of people who are getting it, right? So you still want to wash your hands. You still want to avoid touching your face, as I've probably touched my face 2 or 3 times in this video alone, because it's a hard habit to break. But when you go out in public, use hand sanitizer, wash your hands when you get back home. And the obvious things that we should be doing anyway that I said in the first video is avoiding people who are sick. If you have a fever, stay home. If you have a cough or something, wear a mask. If you do have to go out somewhere, things like that. But so anyway, I'll say that with all that said, one of the things I wanted to talk about is I had my first 2 patients who were positive for COVID-19. I can't say a lot, obviously, about them because, HIPAA and, but what I can say is, you follow all the protocols and you listen to the guidelines on what to wear, what PPE to wear. Fully suit up, like a hazmat suit. Had actually had a P95 mask. And you have to go in and take care of people. And I work in hospice care. So I'm providing care to people who are, these are their last days, right? And I have to go in and provide comfort care. It's a little bit different than the focus on, from the nurses and doctors in the hospital who are trying to prevent them from passing, right? The patients I get have signed a DNR, and they are at the point of saying, listen, I just want to pass comfortably, and I want to pass at home with my family, if possible, right? COVID-19 kind of changed that and kind of made things kind of different in that regard. So one family I took care of, they got creative. There was a wife and another family member that were in the house with the patient. They fully suited up when they were in the room he was in and wore N95. However, everyone else, it was a really creative idea, and it was it's kind of sad, but at the same time, it was good to see because what they did is he had this window, and they came up to the window, and he could see them from the window, and they came up to the window and would wave at him, and things like that, and he was able to wave and see faces and essentially say his goodbyes up until he passed. So that was, it was a sad moment, but also it felt good to know that he was able to say goodbye to his loved ones. Because if he was in the hospital, most hospitals now have banned people coming in to the hospital to visit. So they're having to do this over FaceTime or over a phone call. And seeing somebody in person, even though you may not be able to hold them, hug them through a window is, I've never seen it in all the years I've been nursing. Seeing somebody have to do that. And then another family I took care of, the family was right there in the house, and they were quarantining. Once the patient passed, they were starting their 14-day quarantine. And they were right there, and that it's kind of a scary thought because you feel for them too because are they going to get it? More than likely, chances are they will. So for them, that's got to be a scary thought. But their focus was so on taking care of their loved one, making sure that they got everything they needed. And giving them their medication around the clock because I'm not there around the clock. I come in, do an assessment, make sure that they have plenty of the medications they need, and the family has to do the rest. And it's sad because they do not even really get the full experience of having a chaplain come in or having social workers or a CNA come in and help them because all of those visits are limited. You're having to do those, chaplain and social worker over the phone to limit contact, to limit exposure. So it was a whole different ball game. Something I wasn't used to dealing with or going through. So you kind of are it, in a way. You're it. You've got to, act as everything, every discipline in a sense. Finding out, well, do they need a chaplain? Do they need these phone calls to increase and just different things like that they may need, and then also just trying to figure out, okay, well, does the family need anything? You're quarantined. Can I bring you Diet Cokes or whatever, or um, something to eat, or well, I couldn't find any toilet paper, but so I was like, I hope y'all have plenty of that. But so anyway, it is a scary time, but like I said, I don't want to continue making these videos. Um, I'm trying to figure out about possibly testing. That might be a video I would do. Would be to so everybody can laugh at me getting the long probe into my brain. As everybody I've heard said, it's the most uncomfortable thing uh, to get tested for COVID. Anyway, so this is my first time. I just did this live off the top of top of my head. Probably saying a lot of ums. I always do in videos. Go back and I look at putting the videos on YouTube on the YouTubes, and I say a lot of ums. I don't know. I got to work on that, I guess. But anyway, so with that said, a lot of questions about COVID, and I always tell people, hey, look, just go to the CDC website, go to the World Health Organization website. It's constantly changing, constantly new information. And everybody stay safe, wash your hands, try to stay home if you don't have to. That was the other thing, I will say real quick before I get off, the video's getting kind of long, but I'll say when I was getting out, I live in a large city, and when you're getting out in the public, and I'm like, man, there are a lot of cars on the road, and I'm thinking, can all these people be essential? So that was kind of crazy to me, and a lot of people are like, well, how would you know how many cars are on the road? Why are you out on the road? Well, I kind of had to be for work to see these patients. But other than that, even then I was kind of limiting the visits, trying to just mostly stay at home. Plus, I got little ones. I've got kids at school's canceled. I'm like, Lord, please, let's get back to school, please, please. These kids, I don't have any hair, but it's gonna be all gone because these children, there's something else. But anyway, like, subscribe, all that good stuff YouTubers tell you to do. And tell me if you know anybody. Comment, if you know anybody or you've gone through anything with COVID, or you've been affected. Tell me your story, because it is unprecedented, and I'm hoping that they come up with a vaccine really soon. But when I say soon, clinical trials and things take a long time, and I think normal ones can take up to a year or more, 2 years even. I think, but I think in this circumstance they're probably allocating a lot of resources into it, trying to speed that up as much as they can, as safely as they can. But yeah, if you have symptoms, go to one of the drive-in testing areas. Drive in and get tested if you have one of those in your area. I know I tried to sign up the other day. I was like, well, I've been exposed. I might as well get checked, because usually they only want to check people who have symptoms. But I had 2 exposures, even though I'm wearing full PPE. Still, it's just, I'm like, I don't want to go around spreading it to anyone else. And the place I was trying to go to didn't have any materials right now to do the testing, so I'm waiting for them to get more stuff in. They said they would soon, and so I'm waiting for that. But if you can drive in and do a test, especially if you're having symptoms, I would recommend doing that instead of going to, like, say, a hospital or something. Because here's the thing. You go to the hospital and you think, well, maybe I have it, right? And you go to the hospital, but you don't have it, right? And then you get around all these sick people, which I know a lot of hospitals are doing a lot of measures to make sure people are separated and quarantined off. But I would try to avoid it if you can. If you can go through a drive-through testing center, I would do that first. And unless, of course, you're having shortness of breath and things like that, then you need to go and be admitted, essentially. But anyway, everybody have a great day, and I'll see you again soon.